So first off, there was a couple things that surprised me specifically about the literature and their findings. First, that generalized joint laxity didn't appear to be a risk factor for ankle injuries. I just sort of, I guess, assumed that generalized joint laxity was a risk factor for all injuries, so that was interesting. And that also that the increased age of menarche was an increased risk for stress fractures. But in a more general sense, not a lot surprised me about the reading. There was a lot of reference to really low quality, low sample size studies, and I'm sure that it's really difficult to control and develop a really quality study when you can't control for all intrinsic and extrinsic factors. So how could I use the model for sports injury in my daily clinical practice? When I was reading it, I was thinking of, more comprehensive SOAP notes and look for more external and document those external factors like the teammate, the coach, the referee. Those are really important, but when we, write a SOAP note, we're saying, how the athlete was feeling, what was the mechanism, but we need to go beyond the standard SOAP note and the standard inclusion of our information. So more specific person-based rehab as well in my clinical practice based on the model, looking at postural stability and joint range of motion and not just getting stuck in these are the exercises that I use for ankle rehab and these are the exercises I use for knee rehab, but really taking the time to sit down with the person. And I think we've started to do a better job with that with the patient-rated outcomes, but this gives us just another outlet. And how can I start today doing a better job? I think the number one thing I'll start doing is really sitting down with the patient upon them getting their PPE. So we'll do, a whole new round of PPEs come July and August. And it's really important to sort of sit down and have a conversation with the athlete rather than this is, the station for blood pressure and this is the station we're just getting people out the door as quick as possible because we have a lot of athletes. But what if we miss things like previous history, technique, instability, things that were referenced in the article that I think are really important. And then lastly, using the SEBT to baseline my athletes. I think I could easily do that since in the article it referenced that it can be used to predict lower leg injuries, and I did have a lot this season. So that's where I'll go from here.